This is my life. I don't do my hair, and I'm immediately regretful because then I'm on camera. Thank God Lilia whipped out this braid real quick, and I got some earrings in my purse. Let's go do this, okay? I do have a really special thing, so we had to do this video today, and I'm super grateful because he's gonna let us like speak to him instead of just show his chest.
Okay, cool. Good.
So yeah, this is this is how things work around here. It moves quick. Okay, I have a camera. I always say the same thing in these videos that I'm excited to do it, but like I'm like really excited to do this one because it's kind of different than what we talk about a lot. So we were kind of going through his history, and I had obviously seen his photos from his virtual consultation that he sent in, and I could tell that his gynecomastia was just maybe a little bit different than other people. It's almost a tubular shape. And then we sat down and he was open with me, we talked a lot, and I got his history, and turns out he had a pituitary tumor that is benign, diagnosed about 5 years ago or so. We were trying to do our timeline, but that's kind of close to the timeline. And he noticed this only about like a little less than 10 years ago, which I don't hear that a lot because he's almost 40. Almost 40. I'm 40, we can talk about it. And so yeah, for gynecomastia to show up in, around 30 and not be related to steroids is kind of unique, right? He had a kind of a weight gain at that point too. Showed me some cool pictures of how his chest used to look, and hopefully I can put those in this video as well, because I think that's super informative to explain his journey and where he was and where he is now and how dramatically different it is. And so all that comes back to this benign pituitary tumor that he is taking medication for, but that is directly related to gynecomastia. And I'm just now kind of learning about this because I have not had a lot of patients come in who've had a benign pituitary tumor that caused their gyno. And so we don't really talk about that very much, but it all comes back to hormone issues, right? The tumor does cause issues with your hormones, and so that causes gyno. So let's take a look, okay? I'm gonna pull down this here. Okay, so what do you think?
Yeah, I don't remember seeing myself other than this.
Other than this?
Yeah, when I look at pictures, I was like, I was skinny, right? But then I started gaining weight. I getting older. I thought it was normal, right? Mm-hmm. I didn't thought it was something other than that, right? Mm-hmm. It's not until we got excessive blood exam that it turns out my prolactin was very high and my testosterone level was very low, and it turns out it was a pituitary gland. Mm-hmm. So yeah, I think that at the end of the day that was caused by gynecomastia. Mm-hmm. I didn't know that was a thing back then. It's just it was what it was, right? Mm-hmm. After going to different doctors, and the doctors endocrinologist, he told me like the only way for me to get rid of it is surgery. So, but at the time I was like, well, if I go to the surgery, does it grow back again? Mm-hmm. And he didn't know, but he thinks it could be, right? I was like, well, let's fix the hormonal problem first before I do the surgery. And that was about 5 years ago. I get to the point where I'm like, I think I'm ready just to at least, let's look around. That's where I find you guys. Mm-hmm. And you have a ton of documentation, a ton of videos on this about years, right? But I didn't make the connection till I came here like a month ago, where you guys removed the whole gland. So the probability of this thing growing again is super low. Mm-hmm. I was like, yes, how can we make this happen? It turns out that you guys have dates available, so here we are.
Yeah. Okay, very good. I like I said, I want to show you guys the before photos before this happened, but we were talking about the shape of his chest And he was also saying that he didn't see a lot of videos or photos of people's chests that look like his, right? And so I think that's why you were kind of compelled to do this video, so appreciate that. But as you can see, this is a huge amount of gland, okay, right in here. But you see it protrudes out this way, like a tubular breast, okay? And you see how expanded out this areola is. That's because this gland is forcing that areola out, and it is stretched as much as it can stretch right there. You can't even really, you can see the nipple just a bit, but it is expanded so much that you can't even truly appreciate where the nipple begins and ends, okay? So we're gonna go in, we're gonna get all of this. He mentioned that Dr. Caridi told him a month ago that we get all the gland, and I think that is very reassuring to people. And the way Dr. Caridi describes it, he always says it's like a car with no engine, right? So if you take the engine out of a car, it can't run, right? If you take all the gland out of this, it can't grow. And so that's obviously the goal today. And we're gonna get all of this. I do wanna focus later on talking about skin management with him, because although his skin is doing really well, he's young, I will probably use tape, I'm assuming, and we'll definitely use the lipofoam to hold the skin back so that it is flat and gets rid of all that swelling, this lipofoam. I talk about it a lot, it's my favorite. But I'm very excited for him. He has been very open about his situation. His wife has been cracking me up since she walked in the door, so we've had an awesome morning. And I know what's on the other side of this, meaning I know in 2 hours he's gonna be so happy. He's been a little bit anxious today, so we're working through that. But I always get excited because I already know what's in the future. It's you guys that get nervous. So anyways, we're gonna take you into surgery, show you guys a bit of that, and then we will see him back tomorrow, show you the 1 day post-op hopefully, and just really wanted to share this kind of unique case of a benign pituitary tumor and the effects it has on the person and how it causes gynecomastia. Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community. It helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
Unbelievable. Lacey, I guess she got into you. Did you see her excitement and enthusiasm?
Yeah.
You know why?
Are you gonna be the same excited?
Well, I already am. Can't you tell? But you want to know why?
Ouch.
She drank the coffee. Does that hurt?
No.
Because you may be the frozen shoulder guy that, he's kind of covering this up. So to reiterate the story a little bit, he had was a pituitary thing, right? Mm-hmm. Okay, so what's interesting to me about your story is that I always tell people that you can use gynecomastia as a way to indicate that you have some kind of medical problem, but it's very uncommon because most of the time you have a medical problem, you know of it, and then you got gyno. So, but in your particular case, gyno could have been a clue, right? Because you didn't know about the pituitary thing until after the gyno, right?
Well, I wasn't sure about gyno overall, right? That wasn't
even on your radar.
I learned about that after. The problem was the hormones were out of whack.
Yeah.
And my product thing was I was always tired. I sleep a lot, and it turns out that the pituitary gland was the fault.
Yeah.
The endocrinologist is the one that pointed out, like, because of that I got gyno.
Yeah.
So I was like, all right. And he's the one who told me that the only way I can get rid of this is surgery. Before that, other doctors told me just do push-ups.
Yeah. Or maybe you could take something and go away or whatever. But the doctor told you the only treatment is surgery, right? Mm-hmm. Which is true. Now, the interesting thing, put your shoulders up. Come on. There you go. The interesting thing is the shape is more tubular than others, and you got a good rock in there. He went to, if I recall, you went to other docs that recommended skin removal. Mm-hmm. I would not have recommended skin removal. We don't recommend skin removal. I'm going to show you what we're going to get without skin removal. Now, Some may recommend an incision around the areola to make it smaller because it's so big, but this is going to shrink down really nice without that incision. The problem with the incision is if you do the incision at the same time you remove all the gland, that's going to die. So that's why you don't do it at the same time. That would be like a cardinal sin. So that's not what we're doing, obviously.
Do some people do that?
Well, you know, maybe they did. I didn't see about it, but
one of the other doctors told me, rearrangement of the nipple.
Rearrange it to move it. So one of the things that, you know, we can help, well, you know, we help a lot of people, but it goes like this. You really can't do a lot of rearrangements of the nipple if you do the technique that I do, which is complete removal, because if you take all that tissue that's theoretically the blood supply to this and you try to move it around, it's just going to die. You could leave the tissue and then move it on the tissue and it still may die, but then you also left the tissue, so it's like, what's the point? The point of this is don't overanalyze it. When he's done, you'll see here shortly, this skin will go back very nicely and this will get a lot smaller. And so, you know, life goes on and all that kind of stuff. Now, you can make the areola smaller, let's say 2 years later, a year and a half later, because the blood supply reconstitutes and all that stuff. But I haven't had to do any of that because everybody's pretty happy with what they get, you know.
I mean, anything smaller than this will be.
Well, yeah, of course, anything is better than this. But, you know, we're really just trying to educate other people that have similar things and stuff like that. What else? What else are we talking about, man?
We're good.
We talk a lot when I came.
Well, you guys have so I'm just the technician now. Okay, so everyone else talked about everything else that's important, but I'm just going to be the technician. So if that's the case, I'm going to show you how I technize this case. Okay, I'll show you how I technize this case. We're going to get a good specimen out of you, my friend.
You can see it's already herniating. Look at that.
Yeah. One of these times you gotta put the case against the clock to show how fast it is. Because I bet you other people take hours to do this. Look at that. Wow.
Oh, yeah. Got it. Austin, can I also get some more lap? Whenever you get a chance.
She's a busy woman. She's got a lot of acting and actressing stuff that's going on out there.
One, two, three, four, five. Oh, sorry.
Yeah.
I did not expect to do that.
You can see how everything just deflated. Look at that. Wow. Skin went right back. Good skin.
Look at that. Beef.
Oh,
Good
real
skin,
beef.
yeah.
That's the real stuff. All right. Audrey, can you pull the pedal down? It was 335.
Oh, that's right. You didn't do any of it.
No, because you taking it out.
Yeah?
It's by you.
So, Mike, are you getting on this on video?
Yeah, we're rolling.
Okay.
Been rolling.
Well, we just have fun for a minute, just to clarify the whole hormone thing. So, it's unusual for someone to present with gynecomastia that's caused by a medical problem that doesn't already know about the medical problem. Usually, they know about the medical problem, then they have gynecomastia. So, the point is that gynecomastia is a symptom, okay, a manifestation of something else. And the most commonly that it's not a medical problem. This guy went and he got tests to show he had a hormone issue, but I dare say for most of you out there with the ordinary run-of-the-mill gynecomastia, nothing's going to show up on your panel. And certainly you don't need scans or radiology imaging because it's just not going to come up with anything you don't already know. Breast cancer itself in men is very rare. I've never seen it actually. And gynecomastia is not associated with breast cancer. And that's what's something that gives a lot of people panic because they think they have that, but nobody wants to have a cancer obviously, but there's really no correlation. So in his case, he just went out. I guess he did it by himself. You listened to him. Did he say he just went to a endocrinologist?
Yeah.
Found out he had a prolactin problem?
Prolactin.
And prolactin in itself doesn't cause directly gynecomastia. It just causes an imbalance. The ultimate cause of gynecomastia is an imbalance between the sex hormones, testosterone, and estrogen. So people who tell you about all these other things that cause it, like insulin or some fluctuation of this or some fluctuation of that, marijuana, whatever, it's perceived that the number one cause is the imbalance of the hormones, testosterone and estrogen. So things can affect that balance, and that's what you'll see as a possible manifestation is gynecomastia. So I'm working with the Vaser system, ultrasonic liposuction, to just get around the outside of this. I'm not working in it. I don't want to necessarily get inside of this because I don't think it's going to do anything. I'm getting outside of it to separate this mass from its blood flow to some degree and to really just dissect around it so it's easy for me, or easier for me, to use my finger to dissect around the perimeter of the mass to get it out. Vaser in and of itself is thought to promote skin retraction, skin tightening, but that's not what I tell my patients because if it does that, it's so little it doesn't contribute anything. There's no real skin tightening method that does anything clinically, meaning when you saw that side contract, that's because he has good skin, not because I use Vaser. It's like you're in a sinking ship and you have something that can get out another gallon of water or something. You know, that may be true, but it's not going to make or break anything. It's usually just a marketing tool that everybody wants a tight chest, so tell them that, you know, it tightens the skin. It doesn't. How do I know? Because I've done a few of these. Few thousand.
And if there was a machine that I can buy to just make everything tighter, I would. But I don't, because it's disingenuous. It's not true. It's not my thing. I just tell you the truth. The truth shall set you free. It's really stuck underneath his nipple iridolar complex, big time. How long was I?
You're past it.
Past it? All right.
Yeah.
So we're good.
Audrey, the time is 4:42.
Another fundamental way to look at my approach to this guy now is, it doesn't make a difference what caused it, treatment's the same. I'm not treating it differently because this is caused by
Hormones.
prolactin. It's all treated the same.
But I found it interesting that his endocrinologist, who deals with hormones, didn't tell him he could solve it with hormones.
Well, he just knows better. You see, I mean, an endocrinologist or any doctor for that matter can say, oh, well, I give you tamoxifen, an anti-estrogen, blah, blah, blah. That's not going to touch this thing with a 10-foot pole. It's not going to touch anything. I mean, the best indication for that is someone who's just can't have surgery, I guess, and has some pain. And therefore, it does help with the pain when it's inflammatory gynecomastia. And it may shrink it a little bit, but the amount that it shrinks it is so insignificant, you're still going to have gyno. So what's the point, you know?
I feel like you're getting it on the camera.
Oh, man.
I don't know if it is on the
No,
camera,
that'd
but it
be
just
funny.
it just keeps flying, and I'm like, oh, got some juices. I get some juices on the camera. Uh-huh.
All right. And here you can see how superficial I am, because this is what's the primary mechanism by which I shrink the areola. Thin flap. Thin flaps shrink.
Well, look
So
how
not-
light that one is
yeah.
compared to this one that's dark.
Yeah,
You
look
see?
at that. Yeah.
And it's like the difference
That's
of
cool.
the retraction.
Yeah. Well, you have more
You see
paper
that?
cells. It's just stretched out.
Isn't that
you know.
wild?
So his areolas will shrink. They already shrunk on the table.
Yeah.
You can already see that. And he won't need any. One of the docs I think he visited said he needed to have skin removal. And clearly, if you've already seen, no, not even close. And that's the problem, is that, you know, a lot of docs think that, oh, you know, it's just gyno, blah, blah, blah. No, it's a real deal, and you got to do a lot of them, and you got to learn some fundamentals. And once you learn the fundamentals, you'll become more. See, this is the white stuff that was underneath the nipple iridolar complex. But this all was well circumscribed. Whoa!
Oh, see, I
Michael
told
Maya
you.
got his. Michael Maya got
I
it.
told you.
This one's even bigger than that one, so look at that.
That's wild.
And if we cut into the, let's cut in here, Micah. See what we got. How thick the? You want to get in on this? So this is the where the sort of the white glandular stuff is. We cut into that. Well, look at that. Blade came right off there.
Took your.
Took my blade off. Anyway, you can see.
Wow. Wow, that's the most dense white
Yeah.
I've seen.
Well, I see it all day, but that's all normal. But it's just, I mean, it's not cancer for sure. Soft, not really. But you can see how.
Can you turn the suction on?
So now I'm going to
please?
sculpt his chest. So now that I got the mass out, I could leave it, I guess, but then it wouldn't really look as cool as we wanted to. That's why the liposuction is essential in most cases, because it's designed to sculpt the remaining chest so that it looks nice. More definition of the muscle, V-shaped, masculine, all that stuff. That's why my zone system is really good. My classification system goes by zones. I'm treating down here, zone 4 right now. This is lateral zone 1. He doesn't have much on zone 2. A little bit. I may have to go out there. See, sometimes if you take a big mass out of here, that will look big. So even though it looks like on the picture there that you didn't need to do anything out here, yeah, you can see he can benefit from a little bit. Doing this under local anesthesia would be pretty
Gruesome.
pretty brutal, yeah. So that's why we have anesthesia. And I'm doing a little bit of zone 2 here, lateral zone 1. And he was like, "Oh, anything will be better." Oh, no, we'll make it even better than that. How about we'll give you a really good chest? I like when the expectations are low, then I seem like a superhero. So what's really kind of cool is he gets to wake up, you know, within a short period of time with a normal chest. Remember what I always say, great skin, great results. Assuming you do it normally. Normally. All right. Boom. Check underneath this areola. Scissor. A little bit of, and he can have his nipples can sort of fall off if you want to put it that way. Not fall off, as if they shrink down. They can essentially lose their blood supply. He doesn't have much of a nipple anyway. It's a small price to pay for a small nipple real complex. So you can imagine how happy he's going to be when he sees himself, you know? Yeah. It's amazing.
One, 2, 3, 4, 5.
And so after we remove that big mass, we want to make sure that we achieve hemostasis. So we pack the big open area where that mass was with the, well, I still call them rags, but
A lap pad. It's a sponge.
yeah,
Basically just soaks up
40 some odd years of
Anything.
surgery, I still call them rags.
Well, because that's kind of what they are.
Looks
just
like I'm
in
from
a different,
Brooklyn. Yeah, it looked like a rag for me.
Just in a different
Check the
aspect.
oil with these things. So we put that in there to absorb all the water too.
So you
'cause-
can see it.
so you can see all the liquid. And then the dark red area will tell you if there's more blood. So like over here, wherever
Which
that
is
was.
more
So it's probably
lateral.
over there, which would be a common area. So Mara's going to get in there and look around.
I'm gonna take these.
Usually these are small vessels that don't cause any problem. You just want to make sure there's not a bigger vessel that's just quiet right now, but it's going to come. It's going to awaken with time after the epinephrine sort of wears off. Epinephrine constricts these vessels, and after the epi wears off, they can open up a little bit. So we just make sure it's nice and dry, and that's why we wrap you when we're done. We put some aces on there as well. And he's got a lot of extra real estate here that's got to squinch down. So he can have a little crease or something on the areola. I mean, you can already see these creases because remember this is thick here, and also you get to here, and this is really thin. This is just stretched out tissue. Nothing underneath there. And so you got to make sure that when he's healing, it's sort of flat. And the most
That's
important
one of the
period of
reasons.
time is the early part, not like weeks later. Just make sure. So see that was probably up over here. So look for anything that's bleeding way up under there. It's actually going towards the little,
Incision in the top.
yeah. Yeah, it's right there. Yeah, that's good. And then let me show you the benefits of my internal closure now. So you could see this sort of, yeah.
Yeah.
So you could see this is a
Watch
little.
your head, Micah.
Watch, Micah. You can see this is a little high here, and it's a little high here because we took this mass out over here. So we're just going to do, again, plastic surgical principles. Close this in layers, right? So I got a beautiful layer here of normal stuff. I'm going to close this to this normal stuff. Tissue, whatever. Ooh. And you can imagine if I didn't have this or I didn't do this, then that would look weird. It'd be like a cleft or something. Look at that, boom. So this is fundamental to the paper I published in the pandemic era, I guess. Nothing else to do. So I did something good. Alright, so that's good. Those two there. That looks nice. A little bit of Humpty Dumpty in this area here, but nothing crazy. Just want to take a little bit off here more. The edge. Just. Okay. Boom. Yeah, nice. Much better. And look how nice that lays down. That's perfect. Boy, it's amazing that high quality elastic skin makes me look good, doesn't it, Micah?
I like that.
Makes me look good, right?
Guys,
Wonder Boy. Well,
night and day.
yeah, night and day. This is these are fascial flaps here. These are not just fat. Boom. Nice. Appreciate you guys. Thank you.
Hooks and unzips. And get you a mirror. Alright, this is that lipofoam you're going to wear for 2 weeks. And then you've got the pads over each incision. Let me give you this mirror. I know you're still drowsy.
Wow, I cannot believe it's gone.
I know. It's crazy.
That's it? Just those incisions?
Yep. Got those dissolvable sutures right there. And then you got the little tiny incisions in your armpits. They're teeny tiny. I don't know if you can see right there. See?
Yeah.
Yeah. They're teeny tiny. Right there.
Oh my god, yeah.
I don't feel that. I feel like a heavy
Yeah,
weight
Yeah.
in the chest.
Yeah, you're still a little numb right now, but you are getting a little bruised. This lipofoam helps push all that bruising down. But it's crazy, the difference.
That's the trouser, like,
I know, it's awesome.
wow.
And we just put a little tape right here to kind of help your areolas kind of just stay in place. So you can just leave this tape on for a few days.
Perfect.
And then you guys are coming back tomorrow, right?
Yes.
Okay. You guys don't have to mess with anything tonight.
No.
Just leave everything alone.
Yeah. That's us. That's the best part. They're like, yeah, we're staying. We're staying.
Wow.
I know.
I don't see the bulb anymore. That's insane.
Yeah.
It is. Wow.
It's awesome.
You're in shock.
I know.
It's not as painful that I thought it would be.
Yeah, everyone's pain tolerance is a little different, but most people just say it feels like you did like a heavy chest workout.
Yeah. When I do it, I can tell, but I never done.
Okay, you can give her the mirror.
Letting you take it all in.
Wow.
I know, it's awesome. And then I'm just gonna change out these pads for you. Oh, there's actually not too much drainage on there. Yeah, she'll just keep those. But yeah, it's
Wow.
awesome.
I'm surprised that there's
Got it.
no blood.
Yeah, so the drainage really comes out of the armpits more so, but sometimes it's not a lot. It's really just the fluid that Dr. Caridi infiltrates, kind of making its way out.
I never saw him.
You never
What?
saw him
What do you mean?
inside,
I mean,
like after when you
yeah.
went in.
You'll see him again before you leave.
Okay, it was just a
Anesthesiologist.
yeah. Him and couple like girl nurses. That's
That was that's the last
that's
thing
what
I remember.
Yeah.
So
Yes, he doesn't come in until after you're asleep.
That's crazy.
I know.
Like one thing is just watching all the videos that we have watched that like
yeah, going through it.
to
Yeah, I cannot
experiment it.
tell something happened.
I know.
Yeah, it was a big transformation.
Yeah.
Yeah.
Really?
Yeah.
I'll show you what he got out. Too.
Yeah, you want to see the gland?
Of course.
Okay.
Yes.
I mean,
I mean,
I'm
yes.
very curious about
Okay, let me sit you up and
What?
then I'll show you.
what the heck was there.
Yeah, you should see it because it's you'll feel lighter just seeing what came out. Yeah.
Wow. Maybe you lost 2 pounds today. you're going home lighter.
Right.
Holy.
Yeah, wait,
There
that's
you
that. Now I can say, holy crap!
I know.
Which one was on the right?
Right side, left side. So the right side was a little bigger.
That was there.
Mm-hmm.
That's huge.
I know. Do you want to touch it with the glove?
Yeah.
Yeah, you gotta touch it. Do you want to touch it too?
Yes. Let's do it.
Golly.
Wow.
Okay, I'll put this on. I'll give y'all one each.
How does that feel? Like,
Well,
What's
you
it
feel it
take?
now.
what's the texture of it?
Like chicken.
Oh yeah.
Ew.
All gone.
Isn't that crazy that was in there?
Yes.
Why?
So all that white is the gland and the yellow is the fat. So it's all like
Gotcha.
mixed in there. But you had a lot of gland.
Wow. Yeah, it is a lot.
Kind of rubbery.
Mm-hmm.
Yeah, she described it perfectly.
Yeah.
Chicken. Yeah.
Sorry, I hope I didn't ruin chicken for you.
Not really. No.
Okay, good.
It looks like chicken thigh.
Yeah, just
Very precise.
you can't take it home and eat it though. Sorry.
That's crazy.
How?
Yeah. Let me see if Dr. Caridi's out here and wants to see how this.
That is a lot.
How does it? I want to smell it.
No! Then you're gonna touch your mouth with it. He's like, I wanna smell it.
Don't eat it.
I'm like, you're gonna touch your
I mean, you can smell it if you want.
Oh my
It's
god, but
your
you're
gland.
drowsy.
Oh my lord.
Does it smell?
It doesn't smell like anything.
You can take a little lick. I feel like he's really tempted right now.
Yeah, it doesn't have seasoning. No, it doesn't have it though. Look.
This is really big. I thought it was gonna be like half of it, half size.
Yeah.
Yeah, me too. I wasn't expecting it to be.
I know.
That is huge.
It's thick. It's hard.
Mm-hmm.
I'm trying to pressure it, but
He cut into that one. You can see he kind of cut into that one on the video. See how it's cut right here? He cut it in. You'll see in the video when we post it. He was showing the camera.
I've the only video that I'm gonna watch completely is
It's
his.
his. Mhm.
Because when he showed me when he was, I'm like, no, I don't know.
Yeah.
I just want to see the beginning and the end.
Yes.
Not the in between.
That's a lot.
Mm-hmm.
it's way bigger than I thought.
Yeah. Did you know the right side was bigger?
Yeah,
But not that.
Yeah.
but not this big.
It's all out now.
Probably half. I was thinking like about half.
Yeah.
You glad you did it?
Yeah, I'm actually, I thought I should have done it like years ago. But I'm glad it's done.
Mm-hmm.
I'm seeing in awe, like how big it is.
I know. Did y'all get a picture of it?
I want to take a picture
Yeah.
with you.
Take a picture.
Everyone is asking for you, so I want to take a picture.
Oh really?
Yeah. Oh my lord.
Like a fish.
Look at me. Mira para acá.
I cannot, like, yeah, chicken thigh. That's how
know.
it looks. It doesn't smell like.
I've never smelled it up that close, so I don't know.
I've only smelled stuff when he's burning stuff in there. So,
Yeah.
you know, that's the only time it has a distinct smell in there.
Yeah.
Like a barbecue smell.
Oh, no.
Bacon.
No,
Like
it's
burning
Burning
flesh.
burning hair.
Yeah.
Burning hair or something, yeah.
Interesting.
Can I see the other one? The other side.
Yeah.
This one's still big. Like how?
Yeah, I know.
I gotta shoot. Oh my god.
It's thick. It's hard. It's rubbery.
See,
Like
like a piece of meat, yes.
no, it's because it's kind of hard to tell the texture of it.
I don't know. I think chicken is accurate.
It looks like chicken, but
Like chicken breast.
It's harder.
Yeah.
It's harder than chicken.
it's harder than chicken.
Because it's not cooked.
So
I can give it to you. Like, I'll let you take it home in like a little bag if you want to like go home and cook it.
You're joking.
You put some tenderizer.
Dr. Caridi rubs up on me because he's always making jokes about people eating it.
so it is.
You know, it's like the placenta.
Yeah, that's the nutrients.
So,
Yes.
how do you say molleja?
Chicken blizzards.
Gizzards.
It is as tough as
Like
those.
chicken
Yeah, it is. You're right.
It is tough as those.
I used to love gizzards. I hadn't had that for years.
I like those.
Yeah, in
I
Puerto
like
Rico.
those.
They're so good. They're difficult to make. Like
To make them edible,
yeah.
Actually,
I'm waiting for Dr. Caridi because I want
So
him to come in here.
150 left side, 169 right side.
Yes.
A person that you can name them. Put a name on them.
I don't even know how to call them.
this is crazy.
Call this one Ano and that one Ins.
In there. Oh man, Mike, it was in there recording.
I'm right here.
Oh my! He's handing this to me as if like, oh, hey, do you want me to take a bite of this?
Yeah, he almost.
Oh, he was
smelling
tempted
it.
to.
Oh, were you
lick
tempted
it.
to take a bite of it?
I need to smell it because I don't know how I smell inside of
Well,
myself.
I never thought of that. Well,
was like-
here, I could tell when I cut my arm here, the dog. I have a dog that's real good. He's
Yeah.
up there. He's like,
Oh yes. they
goes
do
right
that.
to my cut, you know, and he wants to lick it. Well, it doesn't really smell like much at all, actually. This is interesting.
It doesn't what?
It does smell.
It doesn't. It doesn't smell
No,
at
it
all.
doesn't smell. I mean, salt and pepper, who knows?
Yeah, tenderizer.
Yeah. So he saw his chest and all this kind of stuff.
Yeah.
Skin
Let's
went
get him
back
wrapped
actually.
with the
Yeah,
concussion.
skin went back beautifully. Oh, you
Yes.
put some tape on him.
We did, yes.
Did you capture the tape?
Not going on, but seeing it.
Oh, okay, because the tape is something we need to do a little blah blah on because I think tape helps out a lot.
What's the reason of the tape?
Yeah, hold the skin
The
where it
skin?
needs to be.
Okay.
So think about, gravity wants to bring everything down, so you get the creases and stuff. So the tape is to hold everything up so that when it sticks down where it's supposed to, it sticks down where it's supposed to. Because you have a crease in there for like 2 weeks, that means it kind of got stuck there, and then it's harder to work out. So it's better to avoid it to begin with. So the tape's made temporarily hold the skin where it needs to be.
Yeah.
I didn't realize that I went through the whole process. I thought I was going to get there.
When you woke up here.
Yeah.
Yeah.
It feels like I have a heavy blanket. That's how it feels.
Yeah. Well, it's like my colonoscopy. I had my colonoscopy. I woke up and he's like, "Well, it's all done." And I'm like, "Are you kidding me?" That's
You
it.
didn't let me enjoy it.
I didn't enjoy anything. I was like, it's just
You
done.
didn't take me to dinner.
Yeah.
But that's the beauty of anesthesia. It's a wonderful thing. I love when people said they're all afraid of anesthesia. What for? You go to professionals. It's nothing. It's good.
Even these, he did a very good job.
Yeah, I had my IV.
I didn't feel it at all.
I had it right there. You see your chest? Is it weird?
I see it from.
Look
point
at
of
well, you
view.
don't see mountains anymore, do you?
From this point of view, yeah.
You got flat plains.
Yes.
Well, wait till you
That was
see.
shocking.
Is he coming back tomorrow to?
Yeah.
Oh, good, yeah, because he'll be more awake than he already is. And that means the fact that he's super nice when he's waking up from anesthesia means he's got a good heart, but you already know that.
Yeah.
All right.
Yeah.
We already knew that.
Yeah.
Sweet man,
Yes.
as I call him.
Yes, yes.
Congratulations, baby. And thanks for helping a bunch of people, by the way.
I appreciate it.
That's a big deal. To me, that's a big deal. It should make you feel really good, too.
Let me see the finger that you used to pull it out.
Yeah, you're right. There she goes. There's the finger.
That's the strongest.
You know what the funny thing is? He caught up on the finger. I do all of dissection with the finger.
Yeah.
But I think for surgeons that maybe not use their finger as well, I got to come up with a device to kind of to do the same thing without injuring the tissue.
We can come up with a little robot finger.
I don't know. Yeah,
we
maybe
can
robotic.
Partner up with Elon.
Yeah.
Dissection finger.
Robotic surgery. Yeah.
Yeah.
Called the,
So to remove the gland, how tough it was to remove it from like
You
this?
watch your video. You tell me.
Okay.
You know what I mean? Was I like, or was I like,
Come on, Chris.
yeah, it's like, Well, if I put my foot on the table and I'm doing that means it was really tough. But no, yours, I handled it with aplomb. I could just tell it was coming, and I worked around it nicely. And yeah, you're gonna see it. He's gonna have a
It came out pretty quick, actually.
Yeah, you're gonna have a nice record for the rest of your life.
How many have you watched?
I don't know, 100.
Do you remember you watched your first, Micah?
Yeah.
Yeah.
How do you feel?
Well,
Like,
you could
first
tell he
time?
was like, well, like if you start feeling faint, Micah.
Well, I loved watching like Discovery Health as a kid, so it was like, oh, I am Discovery Health.
Yeah.
You're brave.
Discovery Health. Yeah, it's pretty cool.
And the lipo, how much lipo do you have to do?
Oh, we got a whole canister. Probably. What did we get?
There wasn't a lot of fat. It was about 400 mils.
Yeah,
That
not bad.
doesn't mean anything.
Yeah,
Oh,
that's
wow,
feathering
good
for him.
amount.
That's feathering for him because I had to
Yeah.
go into zone.
Yeah, most of it came out in
Yeah.
mass.
I had to go to zone 2 a little bit to clean that up, or else it wouldn't have looked right. But that's the chest contouring. It's funny how when you see it when it's there, it looks like I could just work in this one area. The problem is when you get it out, you realize you got to work in surrounding areas.
Yeah.
So to make it look real special. See, now you're going to be in the magazines. And I keep saying that I'm aging myself because I don't think there's magazines anymore. You know what I mean? So, you're going to be an internet sensation. Is that what I mean to say?
Yeah.
Well,
Okay.
well, the last time, a couple of weeks ago, I saw an interesting one, and it was like almost $15 for a magazine, and I'm like, oh, that's why they're like slowly dying.
That's funny you said that because
Yeah.
when one day I was taking a plane trip and I didn't have anything on the plane and I was looking at the magazines and it was like $17, $18. I'm like, forget that.
It's ridiculous. I'm like, no.
I'll just look at my pictures. yeah. It's like
Let me get some
you've
filters.
seen these pictures so many times. You're like, forget it. All right, so I'll see you tomorrow.
Yeah. Thank you so much.
Oh no, yeah, no, this is epic.
Yes.
Now I can mold the yard without my shirt.
I'm gonna get you wrapped with those ace wraps real quick.